All right, let's talk about something that sounds like it's straight out of a horror movie: flesh-eating bacteria. But this is a very real, very terrifying medical emergency. We're going to dive into what it is, how it works, and most importantly, how doctors are fighting back with the one thing none of us can live without: oxygen.
You've definitely seen the headlines, right? Flesh-eating bacteria. It's sensational, it's terrifying, and it probably brings some pretty gruesome images to mind. And while it makes for a shocking news story, the medical reality behind that name is actually way more complex, and frankly, way more insidious.
So, let's pull back the curtain on those scary headlines. What are scientists and doctors really talking about when they use a phrase like that?
Well, the official medical term is necrotizing soft tissue infections, or NSTIs for short, and that name really gets right to the heart of it. See, the bacteria aren't literally eating you. What they do is trigger this catastrophic chain reaction that moves with terrifying speed, causing tissue deep under your skin to actually die off. And the stakes here? They are incredibly high. In the US, the overall mortality rate for these infections is hovering around 20%. Think about that. That's a 1 in 5 chance of not surviving, which makes this one of the deadliest infections a person can possibly face.
So how in the world does it do so much damage so fast? The secret weapon here isn't just the bacteria itself, it's the environment the bacteria creates. It basically wages war by cutting off the most vital supply line of all: oxygen.
It all kicks off with this really vicious cycle. First, the bacteria get into the deep tissue, maybe through just a tiny cut. This sets off massive swelling, which physically starts to squeeze and choke off the blood vessels. Once that blood supply is cut, the tissue is starved of oxygen, a state we call hypoxia. And guess what? This low oxygen environment is the perfect breeding ground for the most aggressive bacteria, letting them just thrive and spread like wildfire.
And here's the truly diabolical part. That same lack of oxygen also handcuffs your body's own first responders. Your immune cells, the very things that are supposed to fight the infection, are basically disabled by the hypoxia. So the infection doesn't just spread, it takes out the entire system designed to stop it.
Okay, so when you're up against an enemy this aggressive, what's the standard medical playbook? How do doctors even begin to fight back?
The standard treatment really has two critical parts. First, you hit the body with powerful broad-spectrum antibiotics to fight the bacteria everywhere. But the absolute, non-negotiable cornerstone of care is aggressive surgery. Surgeons have to go in and physically cut away all of the dead and dying tissue to get the source of the infection out and stop it from spreading any further.
But knowing what we know now, that a lack of oxygen is the engine driving this whole disease, it brings up a really logical question. If the infection thrives by starving tissues of oxygen, what would happen if we could just flood the body with it? And that is the exact idea behind something called hyperbaric oxygen therapy, or HBOT. So here's how it works. A patient is placed inside a special chamber, which is then pressurized. While they're in there, they breathe pure 100% oxygen. This combination of pressure and pure O2 forces a massive amount of oxygen to dissolve directly into the blood, supersaturating the tissues in a way that just breathing normally never could. So this brings us right to the crucial point. We have a therapy that seems directly counter the infection's main weapon. The big question is, does it really work? Can flooding the body with oxygen actually help turn the tide in this desperate fight? This is where science meets the really harsh reality of medicine. The use of hyperbaric oxygen for these infections has actually been debated for a while, so let's take a look at what the data actually shows us.
Now, part of the reason for the debate is that this is an incredibly difficult thing to study. These patients are critically ill, and the disease itself is pretty rare. That makes it almost impossible to do those large-scale randomized controlled trials, which are the gold standard of medical evidence. Not to mention, just the logistics of getting a patient this unstable to a hyperbaric chamber can be a huge challenge.
But when researchers take all the data that is available and compile it into what's called a meta-analysis, the results are, well, they're pretty striking. A huge analysis from 2022 looked at tens of thousands of patients. For those who only got standard care, that's surgery and antibiotics, the mortality rate was over 22%. But for the patients who got standard care plus hyperbaric oxygen, the mortality rate plummeted to under 10%.
And that impact goes way beyond just survival. The data also clearly shows that patients who get HBOT therapy are less likely to need major amputations. So this treatment is helping to save not just lives, but limbs too.
So after looking at the disease, how it works, and the evidence, what's the bottom line here? What's the final takeaway on this therapy?
This is probably the most crucial point. Hyperbaric oxygen is not a magic bullet. It doesn't replace the need for surgery or antibiotics. It's what we call an adjunctive therapy. It's a powerful ally that works alongside those standard treatments. It's attacking the infection from a totally different angle, rearming the immune system and creating an environment where those nasty bacteria just can't survive.
I want to leave you with one final, very powerful number from that landmark analysis, and that number is 19.
So what does that mean? Well, it's what's known in medicine as the number needed to treat. And it means that for every 19 patients with this devastating infection who are treated with hyperbaric oxygen, one life is saved that would have otherwise been lost. In the world of medicine, for a condition this fatal, a number like that is nothing short of remarkable.
And that brings us to one last lingering thought. The evidence seems pretty compelling that this therapy saves lives and it saves limbs. So the question we're left with is a much bigger, more systemic one. Why isn't this life-saving treatment available to every single patient who needs it?